Just to give you some statistics, about 40 million people are blind globally. 80% of this is avoidable, and 12 million are in India. And our goal was basically, how do we end this preventable blindness? People are born blind, there's nothing we can do, but 80% of these people actually go blind over a period of time. So the mantra what we used was three-pronged. One is innovate, second is implement, and third is impact. When we say innovate, we need to innovate a product or a service or a combination of product or service which will actually be appropriate. Basically, the device is an integrated device which actually looks at your front of the eye, what we call the anterior segment, the back of the eye, which we call the posterior segment, and refraction. And currently, if you have to do all this, you need to have a couple of devices, and they'll cost you like $60,000-$70,000. And more importantly, you don't have, because this is focused on preventive care, you need to ensure that you don't dilate the pupil, which means the patient will have to spend 4 or 5 hours. And in India, people don't want to lose their daily wage. What is really important is the problem solving is important, not making the device alone. So unless somebody from the community is involved, you don't get to actually, you can identify a person with a problem, but you can't solve. And the other important thing is it can actually screen you for all the common eye problems, which constitute about 90% of blindness in about 5 minutes. And we have got algorithms which can automatically detect whether this patient has a normal or an abnormal eye. And from there is where we will be appropriate to this team, where we then upload it directly onto the cloud, where an ophthalmologist sitting in a very remote location can see the images on his tablet or mobile and can actually send whether this patient needs to come for treatment immediately or not. So this is fundamentally the innovation, which is what we started with. And to be honest, there's no such device in the world today globally. It has to be appropriate for a country like India. You'll have to coexist with, because the stakeholders are the patient, the service provider, the doctor, the institutions. So you can't create something which is completely out of the box, where you have to have a behavioral change in people also. So you have to have a product which will seamlessly fit into the things which are realistically today, and slowly make small, delta changes. What this basically does is, when we take a pre-screening approach, rather than people being screened only in hospital, this opens up new avenues of screening people. So, because when we are saying preventive care, you don't have to only restrict yourself to screen people, because people who do come to an hospital actually either has understood that he has got a problem and he's got the access and affordability to go there. But that is only 15 to 20% of the population. 80% of the population either don't have all the three, or at least one of the three. One of the awareness, access, and affordability. So if you have to screen them, that is, you will have to actually deploy it very differently. And that requires the backbone of IT or mobile health connectivity. Today, we've kind of touched about 700,000 lives, probably changed about 100,000 lives, because we count this because it's very, very important for us. And what is very fascinating in this whole thing is this device has been used in the state-of-the-art hospital in Mumbai, or one of the best eye hospital diabetic centers in Oman. But at the same time, the same device is being used in the most remote backward areas of Orissa or Jharkhand, or even in a mobile van where people actually take it. So when you build a product focused on a problem, what you really need to do is look at the entire scheme of things what you want to attack, and then build the product with that specification. Of course, when you implement it, you may want to implement it in phases. You may start off with the low-hanging fruits, gain confidence on the product as well as on the technology, and then start going deeper into areas where it can create significant impact. what we have in this country is a lot of problems. So we can actually make a significant difference by actually innovating either a product or a service or a combination of both and attack many of those problems. It could be malnutrition, it could be diabetes, it could be cardiovascular problems, it could be nephrology issues, it could be problems of child and mother care. Lots of things are there, and if you can actually develop, the only suggestion, I don't have great experience to tell you, no, this is a recipe for success, but the only thing I can tell you is, if you actually are on the ground, understood the real problem, then you can actually build a product or a service or a combination of both, which will actually make an impact. And always try to go and see how much of impact it will make.